is on the subject State of Mental Health in India by Dr. Pratima Murthy. Dr. Pratima Murthy is a professor of psychiatry and heads the Center for Addiction Medicine at the National Institute of Mental Health and Neurosciences, Bangalore, India. She has been a consultant to several international agencies like the UNO on drugs and crime, the International Labour Organization and the World Health Organization. Her special area of interest is in addiction treatment and outcome. She has helped and evaluated large workplace programs on addiction prevention and is currently interested in reducing risk factors for non-communicable diseases at the workplace. Dr. Pratima Murthy, please put your hands together for her.
Hi, good morning, everybody. It's wonderful to be here. There are two words I learned, Nalini, in a couple of these programs. I had never heard of millennial till a couple of years ago. So it's nice to use a microphone of the millennial generation, if you will. So if it keeps slipping off, just remind me and I'll fix it again. So I think Nalini gave a very good introduction on what is going to lead into my talk. And I've done these talks before, but my experience largely comes from non-corporate workplace settings. So I'm trying to get the learnings that I've had from many of the non-corporate workplace settings to see what are the good practices or what are the learnings that you can have in terms of developing a workplace mental health care programs. So what I'm going to do in the course of my presentation is really give you an introduction to health and well-being, because, as we've discussed, there is no health without mental health. I'm going to talk about the mental illness burden, both globally as well as, in India particularly. I'm going to talk on mental and physical health. And I am going to focus on what I think is very important, in addition to the neurodiversity that Nalini mentioned, is really a developmental perspective to mental health problems and how it affects every employee in the workplace. And we'll define the situation in Indian workplaces, and then we'll look at how to promote mental health, which is relatively an easier thing to do, but more challengingly, how to deal with mental health problems when you actually face them in the workplace. Oops. Okay, so I'll start off with talking about the Sustainable Development Goals, which are outlined by the UN. And as you'll see, good health and well-being is a very important goal in addition to several other goals which look at, human development in this millennium. And as I mentioned, there is really no health without mental health. And I think it's very, very important to understand, while we definitely talk about mental health more exclusively in fora like this and in today's meeting, it's also very important not to disengage physical and mental health too much. And I'm going to tell you how these kind of really are very linked to each other. There is no mind without the brain. And the brain is constantly affected by what happens around us, whether it's infectious diseases, whether it's non-communicable diseases, whether it's our lifestyle, and therefore they're all very closely interconnected, and it's very important to understand that. And of course, the WHO also defines health as a complete sense of social, physical, mental, and spiritual well-being, and not the mere absence of infirmity. And I think this is an old definition, but I think it's a very, very important definition to keep in mind when we are planning holistic workplace interventions. So we all know that, happiness is very important. Mental health, the state of positive mental health is very important for any kind of productivity, creativity, social inclusion, and so on. And that brings us really to look at, I don't know if some of you on this side can actually see this part of the presentation, which really talks about what are the common mental disorders which are present globally. And you'll be astonished to see that anxiety disorders constitute 5.3% of the disease burden. I'm talking about high-income countries where their social indices are high. Anxiety is the foremost, followed by depression. I'll clearly tell you what these are in a little bit. And then drug use disorders, alcohol use disorders, and then the more what we call serious mental disorders like bipolar mood disorders and schizophrenias. When you shift over to India, this is again the global burden of disease estimates, which are made, both based on epidemiological studies, medical data, surveys, and what is called meta-regression modeling. You'll see that depression is nearly 4%. That's followed by anxiety. So anxiety and depression are kind of switched. We have more depression prevalent in India than anxiety. And then, of course, the drug and alcohol also get switched. Our greater disability is due to alcohol use disorder compared to drug use disorder. And of course, the more serious disorders like bipolar disorder and schizophrenia, which are rarer but very severe forms of mental illness, are more or less the same all over the world. And the National Mental Health Survey, which was completed a couple of years ago, suggests that 1 in 10 Indians has some form of mental disorder or the other. Slightly lower than the global estimates, nevertheless enough to make us, so if there are 100 of us in this room, there are at least about 10 of us who has a mental health problem that we need to contend with. And remember, that's a diagnosable mental health problem. And when we talk about the spectrum of mental health related issues, this is about 4 or 5 times much more than the prevalence of mental disorders. Now, what is going to be the cost of mental disorders? It's estimated by the World Economic Forum that mental health costs will double by 2030. When you look at the various costs, there are both direct costs as well as the direct costs in terms of, perhaps treatment, etc. And then the indirect and absenteeism, loss of productivity and so on. And then of course there are the indirect costs, and you'll see that it's not just in high income countries, but also in low income countries that you're going to see a spiraling of costs for mental disorders in the years to come. In our country, communicable diseases were, of epidemic proportions. We still haven't completely, been able to deal with communicable diseases. Infantile diarrhea is one of the most common problems that we still face in our country. We still have mosquito-borne diseases, we have tuberculosis to contend with. But what has happened is we are a transitioning country in terms of, health, and non-communicable diseases are now the new epidemic. And they include cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases. And of course, people don't understand that mental health disorders are as important an NCD as these other diseases. And the same kind of factors that possibly influence the other non-communicable diseases also seem to influence mental disorders. The age of a person, the gender of the person, the financial status of a person, educational status, occupation on one hand, and a soil of lifestyle, which is stress, the use of alcohol and tobacco, unhealthy diets, inadequate exercise, all these form the soil. In fact, all of us know that there are certain biological or genetic risks to diseases like cancer. But there's a very nice saying which I keep using in all my presentations, that genes load the gun, but lifestyle pulls the trigger. So with a lot of non-communicable diseases, there are several things we can do to limit, to postpone, or to reduce the gravity of these disorders by lifestyle. And I work in the area of addictions, and tobacco and alcohol are two very, very serious but often unattended preventable risk factors for non-communicable diseases. Now, in terms of the economic toll of NCDs, again the World Economic Forum with Harvard School of Public Health actually calculated the losses between 2011 and 2030. And if you look at mental illness, you'll see that mental illness costs are going to, in high income countries, are going to, cross all the other costs from all the other non-communicable diseases. And while it's not so in 2011, as we grow towards 2030, it's likely that even in low and middle income countries, that mental illness costs are going to exceed the cost even of cardiovascular disease. And yet the thrust in our country is predominantly, we have something called the NPCDCS program, which predominantly looks at cardiovascular risk. Not that cardiovascular risk is unimportant, but the fact that mental illnesses should not be ignored. So, the risk factors, as I mentioned, is the genetic vulnerability, the environmental influences, as well as, and they kind of lead to various kinds of NCDs. I mentioned a developmental perspective, and I'm going to relate this developmental perspective to the workplace. So we know, for example, that prenatal exposure now to a variety of toxins can affect the development of the child later in life. So, those in workplaces, when there are pregnant women in the workplace, not just ensuring good nutrition, but good emotional well-being, good, making sure that there is no exposure to any kind of toxins becomes very, very important. And of course, at birth, low birth weight, prematurity, birth trauma. Birth trauma is still something that is a very, very, a problem that still exists in many parts of our country, including in fairly, in urban cities and so on. There are still forceps deliveries that occur, and there can be potential trauma associated with it at birth, and various kinds of infections at birth can also cause, problems in the development of the brain and lead to a variety of problems. Now, brain damage in its most serious form can be actually physical brain injury, but we know there is a lot of environmental causes for developing behavioral problems in children exposed to drugs, to alcohol, and, for example, in children who have parents who have problems with addiction, we know that right from birth they can start to demonstrate behavioral problems. And when you come to infancy, childhood, and early adolescence, there's a whole lot of issues with nutrition, childhood diabetes, stress, violence, exposure to violence, and respiratory problems. And in older life, and we're facing this day in and day out, mood problems among children, anxiety problems among children, school-related anxieties among children, very early exposure to tobacco, alcohol, and other drugs. And indeed, this may lead to what are, not just physical problems related to nutrition, but also behavioral problems like mood disorders and externalizing conditions like problems in the way children behave, in their attention, in their ability to concentrate, in terms of hyperactivity, and so on. So if you have a child with these problems, the impact can be tremendous on young parents who have to come into work, as well as, pay attention to children who have these special needs if they have any of these problems. I'm going to skip adulthood because that's the most productive aspect of our lives. I'm going to come back to adulthood because adulthood needs a little bit more attention. All of us here are working adults, and therefore we need to be wary of that. But the other important thing is the care of the elderly. And in India, where we still live in extended families and maybe joint families, or indeed, if you're working far away from your family of origin or family of procreation, you have a responsibility to family, and therefore various things that affect the elderly are also going to impact their workplace. I left my 92-year-old father at home to attend this workshop. I have to go back and make sure he gets his lunch on time. So, these are very, very, important, very practical problems, of the elderly, which invariably impact those of us who are in the workplace. And gender, I can't underemphasize the importance of gender and mental health. We know that, right from gender inequity to, very specific kinds of problems at the workplace. I have sworn I'm not going to talk on the Me Too today, except to mention that I'm not going to talk about it. I'm not going to address sexual harassment at the workplace, because I think that's a huge topic on its own, and I don't want to reduce the gravity of that, by discussing just in passing here. So, but there are a lot of issues, especially in terms of multitasking, that women face and therefore need support at workplaces to address. Now, I'll just mention 3 common symptoms of mental distress One is something that is more psychological in nature, can become physiological, and two which are diagnosable disorders according to the International Classification of Diseases. So the first thing is stress. And what everyone needs to understand, that stress very often can actually present just with physical symptoms. Whether it's in terms of tiredness, muscle tension, reduced immunity, high blood pressure, fatigue, weight changes, stomach upset, skin disorders, headaches, sleeplessness, reduced libido. And it's very, very important to see if these physical problems are either caused or exacerbated by psychological stress. Of course, emotional symptoms are more easy to recognize when people feel excessively worried, they are anxious all the time, they are low in mood, they're not able to enjoy things as they were doing before. The third important thing are behavioral symptoms. So a person who's unable to express a low mood of sadness can actually become very irritable, aggressive, unable to concentrate, become very forgetful, and very often these can be signs of stress which are not really commonly recognized. The use of alcohol to cope is something that we are much more commonly encountering and understanding these days. Earlier we thought it was just a lifestyle, but now we know that a lot of people actually smoke to relieve tensions, use alcohol to reduce their anxiety, their low mood, their frustrations, and so on. And then social withdrawal is another one. And taking medicines without prescriptions is yet another common response to stress. We did a survey in malls in Bangalore, and we found that apparently okay people, about 30% of them are using various kinds of medicines without valid prescriptions. And those are often for better sleep, for aches and pains which they don't know what to do. And therefore, all these kind of problems can be manifestations of stress. Stress can happen to any of us at any time in our lives. And it's important to recognize that and be able to take control of that. When you come to anxiety, anxiety has more typical features, which include, as I mentioned, there may be psychological features, there may be physiological features like a rapid heartbeat, trouble breathing, tremors of the hands, or panic attacks. There might be physiological symptoms like stomach upsets, or there may be psychological problems like worrying too much and so on. Now, if anxiety persists for a long period of time with these symptoms, or there are symptoms of acute panic, heart beating fast, not able to breathe, feeling that I will die and so on, then it constitutes a more serious problem and can be diagnosed as an anxiety disorder. Depression, again, is not just a passing low mood which all of us face when we are in terms of distress, but a persistent low mood, where the person feels very, very upset, particularly in getting up in the mornings, doesn't have any interest in things that they were doing earlier, cannot sleep very well, has very negative thoughts about themselves, about the world, about the future. And when depression becomes more severe, it can lead to suicidal ideations and, even attempted suicide. And these symptoms, if they are present for a month or more, large part of the day or most of the time, then we would make a diagnosis of a clinical depression. And people with clinical depression need to be evaluated to make sure that the depression does not worsen and lead to negative health outcomes. As I would like to re-emphasize what Nalini said, that it's not a deficit in character. It is a biological phenomenon that can occur when there is either independent of stress or certainly aggravated by stress in one's life. Other serious problems are suicide, and we know now that suicides are increasing in our country, especially among youth. Very often these make newspaper headlines, although they're not supposed to be sensationalized. Every day you see reports of suicide pacts and so on, which is a huge indication of distress, perhaps a lack of support, instability, possibly to do with many other larger forces in society, huge disparities perhaps, as well as depression and other psychological problems can all lead to people feeling suicidal. And some of the warning signs of suicide are a much more aggravated sense of low mood, talking about death, engaging in risky behaviors, very negative feeling of hopelessness and helplessness are very often hallmarks of potential likelihood of suicide, and that needs to be remembered. Much less commonly, but of a very, very severe nature, is this group called the psychotic disorders, where a person's judgment is impaired, their insight is impaired, they may not be able to carry on the functions of daily life, they may be troubled by false beliefs of somebody trying to harm them, of hearing voices when there's nobody around, of very, very huge fluctuations in mood. And two of the most common serious mental illnesses are schizophrenia, what we call delusional disorders, and bipolar mood disorders. Some of the people with these disorders are perhaps the most functional. Quiz question to you, Nobel Prize winner with schizophrenia? Okay, you'll have to go home and do a little homework on that. Yeah, that's right. Yeah, John Nash. Yeah, so, but the important thing to understand is that these disorders do not, they occur due to biological changes, they occur to neurochemicals. People with this, I will tell you an example of a wonderful doctor, the most sensitive doctor who has bipolar mood disorder for the last 25 years. He's done extremely successfully thanks to the proper treatment of his bipolar mood disorders. Three of his children are doctors now. So what I'm trying to say is that, gone are the days when we need to look at, say, oh gosh, mental illness, what can we do with this person? To really identifying the abilities of that person, making sure that the person is treated, making sure the person is reintegrated and able to carry on with their lives. Now I come to the world of work. And I think all of us know that work doesn't occur in isolation. It occurs in the context of the person, the family, the social environment, and the community. I'm again very fond of saying that the factory worker never leaves their problems from the home at the gate, at the factory gate. You come in with your problems, you take problems from the workplace. So it's a constant dynamic between the person's environment and the person. And that's very important to consider when we are planning a workplace intervention for mental health. This is another thing I just kind of garnered from various sources, that if we live up to 75, my values have disappeared. That's strange. That didn't happen there. Okay, that's something that we didn't fix. But the important thing is that while about 47% of the time we are not, maybe this was intended to be a quiz. Okay, so basically, we spend about 25 of those years sleeping, correct? 13 of those years working. So nearly 50% of the time of our lives we are spending either sleeping or working. And work is certainly a third of our productive lives, and therefore is a very important aspect of our entire life. This is something that I took from a recent survey. That's your work, isn't it, Optum? I saw somebody in the audience, yeah? This particular one is from the Optum survey on the right side, on the right of your screen, which suggests that nearly 1 in 2 persons at the workplace are suffering from stress. Nearly 43% of them have an impaired body mass index, results with weight and so on. A third of them nearly have a risk for diabetes and hypertension. And of course, what is stressing them? There's another piece of work done by the SHRM in 2016, which looks at the causes of stress at the workplace, which could be professional, which could be personal, and of course, there's an interaction between professional and personal. The professional could be highly demanding workplace with business targets, problems in relationship, particularly both with superiors and peers, problems with team relationships, the workplace culture itself, the work timings, the commute to work, and commute to work is absolutely killing. I don't know if we have answers at the workplace to that, but I certainly think when governments plan, a healthy society, these kind of things like traveling to work has to take priority in terms of determining its impact on the workplace. And of course, personal relationships are something I already alluded to earlier. Okay. Again, on the left side, you see that many people are feeling dissatisfied at work. There's another survey that was done a couple of years ago, which suggests that 50% of them were also not at all satisfied and about 35% of them were only moderately satisfied, but a very small number were very satisfied. And 70% did not feel happy at their work. 80% of the people who were interviewed found it very stressful, and they had relationship issues with the manager, with friends, with learning new skills. So not having good friends at work was something that 75% of people reported. So it seems like the workplace now has become a very sterile place where you go in, do your work, get out. Which is really sad, because I think a lot of our satisfaction in life is obtained by the work we do. The workplace ought to be something that you look forward to coming to in the morning and, enjoy at the end of the day and feel fulfilled at the end of the day. And that seems to be a huge problem with many people as far as workplace related. And when you look at the top stressors in the workplace, now this lack of respect at the workplace seems to be, and this is global, this is not only for these findings in India, but globally as well, that lack of respect and lack of somebody recognizing you at the workplace seems to be a very important factor, along with a lot of things, including work-life balance, personal responsibilities, financial commitments. Now, I'm not sure where is need and where is greed. Because I find across workplaces that there is never ever satisfaction over your material gains that you get from employment. Therefore, perhaps the important thing is to shift from a focus on material gains to looking at fulfillment, several of those, conventional old-time things that were very important to be happy at workplaces. And somebody's got to do that shifting. And this doesn't happen only in the workplaces that you mentioned. It happens everywhere. In government, I work in a government institution, and what was it now, what's happening now, which pay scale, which pay thing are we at now? I don't even remember some of these things. The 7th pay commission. We've been killing ourselves over the 7th pay commission and what perks we should get as part of the 7th pay commission. Half of it I don't understand, thankfully. But the important thing I'm trying to tell you is that, very often this whole thing about need and, comparison with other people is a lot of source of mental distress. Okay, this is something that a colleague who works in epidemiology, Dr. Gautam, has shared with me in terms of stress at workplaces. And what I wanted to point out is the diverse workplaces where people have looked at industry, at banking, at tertiary care, at hospitals, and in universities. And you'll see that with these numbers, the amount of stress varies from 10% to as high as 75%. 75% in the banking sector. Now, this was not during the time of demonetization, mind you. It was well before that. So indicating that, banking employees also feel a lot of stress. And of course, hospitals are some things. And hospitals right now, we are feeling the most devalued of all professionals right now. Because every day, doctors are being, criticized, and things about how bad doctors are is all over the press. So even the good doctors sometimes come to a lot of flack, and unfortunately every sector has high rates of stress. And when you look at alcohol and tobacco consumption, it is even more thing. This is the cement factory in Karnataka, again done by my colleague Dr. Gautam and his colleagues. You'll see that overall nearly half the employees who were interviewed were using tobacco, and now, come on, everybody knows that tobacco is injurious to health. You see it all over the countryside. And when you look at alcohol, it's still quite, about 1 in 5 people. Now, I'm not very sure that this problem alcohol use or social alcohol use, but, I very often don't know the differences. Prevalence of alcohol and tobacco use, again, in another vehicle manufacturing factory, you'll see that about a third of people are using, alcohol, about 12% using tobacco, whereas there are differences in terms of the assembly workers as well as the white-collar workers. So, we did a study of stress in the prison staff in the Parappan Agrahara in Bangalore. That's possibly, if you can work there, you can work in any sector in the world. It's a frightfully difficult task to do, and we looked at them, and as many as 60% of them had various levels of stress. There have been suicides among these people because of the extreme degree of, difficult circumstances that they work with. And you'll see, this is the illustrative example of what I told you in terms of how stress can manifest. You'll see that headache, body ache, pain in the limbs, fatigue, worrying, gas problems, ulcer problems, tobacco and alcohol use, irritability and aggression are all manifestations of stress, and a sizable number of them reported. Now, they reported feeling low on stress, but they reported high prevalence of these symptoms. So they don't recognize it as stress, and that's what we need to understand, that very often these can manifest with physical problems. And when they rank ordered the causes of stress among the staff, concerns for their safety, difficulty in managing prisoners, their own family problems, fear of suspension, financial problems, fear of transfer, and difficulties with co-workers on a pyramid were the rank orders of their reasons for stress in the workplace. Okay, so now coming to the last part of my presentation, which is the answers. And I've put a question mark very deliberately, because we have to very often seek the answers based on the problems that we are facing. So obviously, the most important thing is to look at the quality of work life, which I'm sure all of us, it's very, very prominent in all our minds, which is really health and well-being, job satisfaction, job security, development of competence, and of course, work and non-work life balance, as it were. And of course, some of the answers are in building up, the virtues at the workplace, which are important in society as well. A focus on both personal and organizational growth, leadership, engagement, recognition, positive emotions, resilience to handle various kinds of stress, and engagement and involvement of every level of employee in the organization. And as we discussed, workplace safety as an important concern, improving engagement, reducing absenteeism, improving productivity, and maintaining workability are the larger philosophies of the workplace. The interventions, of course, in terms of reducing work-related stress could be on looking at the characteristics of a job, the control over work, the support people receive, the relationships at work, their role in the organization, and organizational change and how it can be managed. The other things, now I'm not going to really go into the details of what kind of services that you can offer, but I think the most important thing is to create an environment where a person can easily say, hey, I'm feeling extremely anxious today, as easily as saying, I have a headache today. If we can actually say, be able to do that in a workplace with our peers, that is a major step forward. Okay? So there's a whole lot of things that I'm not going to go into detail about. I'm just going to dwell on a few things. Yeah. We also know that disclosure is a complex phenomenon. I'm going to refer to stigma a little later, but the idea that you can disclose without discrimination is something that is simply not there in practically anybody. Okay? There is a personal sense of failure when you disclose. There is also a sense of how people will react when you disclose. So both these things. So I think the first thing that we need to address is our own ability to personally express any form of psychological distress, that it's acceptable, that it's okay, that it's not a failure of character, but something that's gone wrong inside of us. Just like chemicals produce migraine, that certain other chemicals can affect your mood. Okay? So those are very, very important, and that therefore, if that is not there, there will not be a delay in recognizing these problems. And these problems are best handled before they get very severe and then translate into a suicidal attempt or an absenteeism, which can cause greater problems to the organization. If accommodations are requested, if they can be provided, there's a likelihood that that person will talk about it. And of course, confidentiality, appropriate sharing with the work group and reassignment of tasks, and a referral network. And since there is a spectrum of problems that can occur at the workplace, the networks also need to be along the spectrum. Okay? So some people may need counseling, some people may just need peer support, some people may actually need to go for a psychiatric evaluation, and having some kind of a system within the workplace to recognize who might benefit from what would be very, very important. Okay, so this is again going back to the survey that they did in terms of what applicable technology-driven assistance would you require to address your professional or personal stress. Technology is the new mantra. We believe that all our problems can be addressed by technology. It's very exciting to be addressed, to look at technology. And you'll see, therefore, that webinars were quite popular, online chat services, telephone assistance, and mobile apps are all very popular. So I'll give you a sample of some of these, which I'm familiar with. I'm sure all of you are familiar with it. One such app is a colleague of mine called Dr. Seema has developed this app. It's called Push D. You do it, we assist. It talks about self-help or depression, an internet-based program which requires the person to log in for 20 to 30 minutes twice a week for about 1.5 months. And it's also guided professionally through weekly and telephone calls, mails, and SMSs. And it talks about various ways of how a person can cope with their depression, overcome their depression, get a sense of mastery to their depression. With Arogya, Nalini mentioned that with Arogya, we're looking at mobile messaging to look at, the importance of mental health, whether I need to worry about my mental health, how do I take care of it, relationships, how do I feel good at work, how do I actually manage time at work, how do I manage my worries, how do I deal with my personal goals, how do I cope with loss. Interpersonal loss is a very, very important factor for stress. So how do I cope with it? And of course, how can I reach out for help? This is another initiative. I'd like to talk about Government of India initiatives because all your employees can actually use this very well. And this is called mobile cessation. This is now M-diabetes is there. I think we attended a meeting together on M-diabetes as well. But this is M-cessation for tobacco, where an employee can just register themselves. A person can just register themselves and they will receive a series of messages on the importance of quitting tobacco, on the techniques of quitting tobacco, on the steps to do that, how to deal with craving, how to deal when friends are pressurizing you to smoke, etc., etc. It's a very simple thing through the National Health Portal, and the mobile number is mentioned here. The point is that technology has been embraced by one and all, and it's also available in government sites. The other is the National Tobacco Quit Line. Now, this is not a picture that I've put up, but it's a picture on packaging for tobacco now. And it tells you to please stop tobacco and call 1-800-112356. Now, the reason I'm saying that is, just 3 months ago, we've started a national quit line for the southern region in Nimhans. And we do that now in English, Kannada, Hindi, Malayalam, Tamil, Telugu. For anybody who wishes to get help, telephonic counseling for quitting tobacco. So a variety of digital resources from hotlines, apps, social networking, etc., are available, as are things for cognitive remediation, addressing ADHD, etc. I leave it with a statutory warning that no app can replace expert opinion. So the ability to really discern whether I'm okay using something to self-help or do I need to escalate and get more professional help is something that we need to have. We have Nimhan's Digital Academy, which looks now at digital training, and workplaces may well benefit from this. So finally, I'm going to end with saying mental health interventions, mental health promotion at the workplace makes a huge lot of sense. There are a whole lot of challenges. I think we need to look at it as a continuum model from being healthy to having some mental health problems to actually being ill and taking appropriate steps to deal with that. So what do we do for people at no risk, at low risk, with manifest disease, with undiagnosed disease, and these things. So finally, I'm just going to end on a positive note on stigma. I said I'll talk about stigma. I'm going to actually talk on I don't know how many of you have seen the Temple Tree video. Can I have a show of hands? Okay, you've seen it? Okay. Are you from that organization? No. This is the hospitality industry, and I'm just going to show you a couple of minutes of that clip before I wind up. Okay. So this is, I just thought it's a wonderful way of inclusiveness in addressing stigma. I just do 30 seconds of it to show you what it actually involves. So this organization has taken various kinds of, persons with, you've seen this, yeah? With varying kinds of disability, especially people with Down syndrome. And I thought that was a very, very good example of how inclusiveness can actually reduce stigma. However, so we can watch the rest of the video later if anybody's interested. So what if I told you that I had these problems? How would my organization react is something that you need to look at and know how to address. So I'll stop here. I'll be very happy to take any questions. Thank you for having me here. It's been a pleasure. Thank you.